This is a recording of this year's Virtual Residency Fair. We'd like to take the time to thank the programs that volunteered their time to present to this year's applicants. This year's PM&R Scholars Virtual Residency Fair is supported by PM&R Recap and Ultrasound Guidance. PM&R Recap is the leading resource for your physiatry board preparation, clinical preparation, audition rotations, and beyond. PM&R Recap offers 35 hours of review videos, hundreds of review questions, and oral board cases to help you become the best physiatrist that you can be. Head to pmnrrecap.com to learn more. Ultrasound Guidance is the innovative new online ultrasound learning platform that gives you instant access to expert instruction. With rapid scans and complete scans of every joint and peripheral nerve, Ultrasound Guidance is the perfect way to jumpstart your MSK ultrasound learning. Visit ultrasoundguidance.com to learn more.
Thanks for having us on. My name's Sarang. I'm one of the PGY3 residents here at Rutgers New Jersey Medical School PM&R program, also known as Kessler. I'm joined by a couple other residents and our associate program director. Our associate program director is Dr. Roger Liu, incredibly charismatic and enthusiastic program director, so we're happy to have him on the call. He's here along with the residents to answer any questions you guys may have after our presentation. Also joined by Dr. Leo Chatteroon, who's a PGY3 as well, and Dr. Janae Parrish, who's also a PGY3 resident. So without further ado, I'll just get underway. And okay, so we'll start with a simple house staff picture. Here's our program, full of a bunch of smiling people. We're a pretty big program, as you can clearly see. So in contrast with a lot of physiatry programs, we have a lot of people. We have 25 ACGME accredited physicians in the entire residency. And so that comes out to 2 classes of 8 and 1 class of 9. And basically every third year we have a class of 9. So nothing's particular beyond that. That's just the way it goes. But yeah, big program. At the top, you can see our leadership. So our department chair, Dr. Stephen Kirschblum, probably seen his name on a lot of textbooks. So he is heavily involved in the program and a great chair for us. Next to him is Dr. Manifa Brooks, who's our program director. She's very involved with all the residents and the medical students when medical students rotate through here. And if you guys have any questions at any point during your future, interview season or during the next year, you'll probably be speaking with Dr. Brooks quite a lot. And of course, Dr. Roger Liu, who's our associate program director as well. You can also see some of our fellows in this picture too. I don't know if we talk about it later in the slideshow, but it's probably worth mentioning that along with being a physiatry residency, Kessler also has a ton of fellowship positions for a variety of things. So spinal cord injury, brain injury, pediatric rehab, cancer rehab. So it's a very wide variety of future learning you can do even beyond residency at this program. All right, so rotation sites. We rotate all over the place. Honestly, the residents will experience a ton of different sites during the residency here. But our main site is going to be this building shown here. So this is Kessler Institute of Rehab, located in West Orange, New Jersey. This is a freestanding rehab hospital. It's huge. It's got 152 beds, and you're going to see a wide variety of acute rehabilitation patients here. With all different types of pathologies: spinal cord injury, brain injury, stroke, amputees, ortho, cardiac rehab, all these sort of things going on. And you're going to do the bulk of your training, particularly the inpatient training, at this site here. And consistently ranked one of the US best hospitals for inpatient rehab too. Next is a really cool spot. One of my favorite places to train is the East Orange VA Medical Center. This is one of the places where we can give back to the veterans in our community. This is a rotation that many residents spend many months here doing. And you're going to do a bulk of your procedures and your MSK training at this site. You deal with a very different population than some of the other populations you'll see, because these are veterans that are coming from all over, that have had all different types of backgrounds, that are dealing with different types of things like psychosocial issues that you typically don't see at other sites. So it's a very special rotation. I think it brings a lot to our program to be able to train there, because it's a huge VA medical center itself. And you can also do a lot of SCI and TBI exposure there as well. Next up is the Newark University Hospital. I'm currently training there right now on a fantastic rotation. The type of pathology and the patient diversity that you see here is just incredible. You meet people from all over the world with all kinds of backgrounds, speak all different types of languages. And here's where you're going to do a lot of you're going to get a lot of exposure to MSK-based medicine, to a lot more sort of acute rehabilitation, you know, a lot of ED consults and things of that sort. And like I said, like consult-based medicine, so you're doing your brain injury, spinal cord injury consults at this site too. So different from the other sites, but a place that all residents will train at and have a very specific and comprehensive training there. So we also train in sites in New York City. This is and we offer a lot of optional and elective rotations as well at our residency. So one of which is the Hospital for Special Surgery in Upper East Side of Manhattan. We have an elective and optional rotation that actually many of our residents take advantage of, in which you're able to rotate with the physiatrists over at HSS. HSS is consistently ranked as one of the top orthopedic hospitals in the country, and is really always at the cutting edge of research, and as well as sort of treatment modalities available in the world of MSK medicine. So it's a very interesting rotation that most of our residents take advantage of, that offers you more you know, procedures, outpatient exposure, and again, a very different patient population than some of which that you deal with on our, you know, more New Jersey based and more regular inpatient rotations. But just showing that there's a lot of variety at the program. And we also have residents that started in the last few years rotating at the St. Barnabas Medical Center. This is another you know, medical center in the New Jersey region. These residents work with Dr. Liu, who's also, and you know, they do a lot of MSK-based medicine here and consults. So, okay, education. So our program is very thorough with its education. So we take it, you know, we definitely want residents to feel like they're not just working, and there's a big component of learning as well. So of course we do weekly didactics. This is from 8 a.m. to 12 p.m. on Wednesday mornings. The weekly didactics are completely protected times during your week. So this is protected time from clinical duties. You're not answering your pages, you're not answering calls. You know, you work with an attending in a very, you have a good relationship with your attending, and they're handling things while you're just there to learn and to participate during didactics. Our didactics curriculum is a year and a half. It's an 18-month curriculum. So you're going to experience it twice over the course of your residency. And it covers all topics of physiatry, like gait, amputee, prosthetics, SCI, TBI, you know, all the basic bread and butter stuff. During this, we have our own Rutgers and Kessler attendings, but we also have attendings from other sites and some resident-led didactics and education as well. The next bullet, as you can see, is about grand rounds. So grand rounds is something we do once a month, typically on Friday mornings, in addition to the didactics that you'll have that same week. Grand rounds will cover a more specific topic and theme. And this is actually led by the residents, by our PGY3 residents. And it's a great way to learn from outside physiatrists and other specialists in the world of rehab. We invite guests to come present at our grand rounds, sometimes in person, a lot of times in Zoom. Basically, you know, since COVID, Zoom has allowed us to branch out maybe even further and get more diverse cohorts of guests. But it's a great way to not only learn from outside people, but also kind of work on our networking and just get closer with the entire community of physiatry in general, because it's a small community out there throughout the entire country. And, you know, it's a good way to kind of keep in touch with everyone. During grand rounds, we also typically run like a case session or like journal club that's also resident led as well. Going through our journal clubs, so these are other resident-led groups. Our journal clubs are typically done outside of work, a little bit more laid back. We like to do these with people that are interested in specific topics of these, of physiatry, such as sports medicine, pain, neuro rehab, SCI, anything that if enough residents are interested in, we do these regular scheduled journal clubs, which are typically looking at relevant journals that are chosen by residents, but also sort of approved by attendings in our program that we can discuss just casually over food at a restaurant. I think the last one we did was at a park by the water. We got a big plate of sushi that was covered for by the program. And Dr. Liu was there, and we talked about back pain and radiologic findings associated with that. And Leo helped lead that journal club. It was a really good time. So, just a good way to kind of keep the education going, but in a more laid back and, relatively chill manner. Moving forward, so these workshops and courses are also a big cornerstone of our education. And one of my favorite parts about the program, and one of the cool things about all these workshops that you see here is these are also resident run and resident led. So it's very dynamic and they're very open to creativity and new ideas. So we do ultrasound workshops where, residents come in before work or sometimes after work, and we'll work with the ultrasound hands-on. We're getting in there, we're ultrasounding each other, and we're learning anatomy, we're learning pathology, we're correlating it clinically. We also have attendings present, like Dr. Ma, our VA attending, likes coming to these ultrasound sessions. So they're incredibly just like in-depth, super educational sessions that, we're able to do hands-on. Same thing with our electrodiagnostic. We do EMG workshops that are led by the chief residents. And we actually just finished our EMG workshop this past month, and it was super educational. It was my first exposure to EMG, and I learned so much along the way there. And again, it was very dynamic and resident led. So we were all kind of bouncing ideas off each other to make it a little bit more efficient and also more clinically relevant to what we wanted to learn. We've also done cadaver courses in the past. One of the cool things that we do is work with the NJMS medical students and do a cadaver session with them, with the first year students. And we also have an interventional spine course that's sort of in the pipeline right now and nearing its end. That's going to come into fruition soon, led by Dr. Liu and a couple of our other residents. That's going to be more focused on interventional spine and sort of like a streamlined approach to try to get people engaged in learning about that earlier. And finally, medical students. So I put this portion here because this is kind of unique to our program, is that we have some of the biggest medical student exposure and involvement out of probably most programs in the country. Rutgers has a required 2-week course of medical student rotations through PM&R. So every student graduating at NJMS is going to do a physiatry rotation. What this brings is tons of PM&R exposure to, MS3, MS4 medical students. And it not only gets the word out, gets them exposed to something that, maybe they haven't been exposed to, but it also makes the residents really take a serious approach to educating themselves so that we can be better educators. I can't express enough how much I've, learned just by being given the role of being an educator of a medical student and having them alongside me, and also how much I've learned from them based on, what I'm saying, whether it works or not. They're super involved in the clinical care for our patients, and they're involved in all the workshops that I mentioned before. So yeah. And there's a nice little gift for you. Okay, research and QI. Leo, you want to take this away?
Got 5 minutes remaining.
Okay.
Everyone, I'm Leo. I'm the PGY series here at Kessler. So we'll touch on the research and the projects we're doing here at Kessler.
Sorry to interrupt. I think the audio is a little bit off. Yeah, I think so. Yeah.
Sorry, I had my fan on.
Perfect.
Sorry.
Thank you. No worries.
So I'll first touch on one of our graduation requirements is a longitudinal research project. So all of us complete by the end of our 3 years here, a longitudinal project. This may be something that one of us, just comes up with on our own and wants to start from scratch. But there's also many projects that are ongoing that we can jump onto, for continuity and depending on how much research interest you have. And we present these every year, the graduating class. And a great resource for our research is Kessler, our main inpatient rehab hospital that we work at. It's unique in that, well, not unique, but one of the few that has both SCI and TBI model system programs. So just, in case you're not aware, model systems are funded by the National Institute of Disability, Independent Living, and Rehabilitation Research. And given we have 2 floors, both dedicated to SCI and TBI patients. So we get great exposure to both populations and always have, great resources available if you want to write anything up. We also have the Kessler Foundation, which is a very large research facility attached to our, main hospital at Kessler. So, we always have ongoing research attendings and residents, fellows involved. And also another requirement of our program is we're all involved in a QA, a quality assessment and QI, quality improvement project. So these are projects that residents come up with and carry out to improve things that we find most beneficial. So for example, one QI project I heard about was our transition of care website, which is how we get a lot of our information for pending admissions. It was a QI project by some of our residents just to make the whole transitions of care between the acute care rehab hospital or acute care inpatient hospitals to our rehab hospitals. So, definitely get good experience if you're interested in research here. Now we can go on to the next slide. And this is just a slide going over our culture here at Kessler. I have to give credit to Dr. Liu and the rest of the admissions for, honestly selecting great people as well as really impressive and brilliant people. So you can tell from the pictures, we often hang out even outside of work. We have, like Sarang touched on, journal clubs. We have a humanism group. We're in New Jersey, so New York is very accessible, so say it's awesome just to go to work with people you don't mind being with every day. So we should move on to the next slide.
Yeah, we're literally planning, like 30 minutes ago, we were planning like a weekend barbecue at our friend's house this weekend that all the residents are going to. So
yeah,
we all like to,
yeah, worry about one of the attendants, Dr. Liu's invited.
Yeah.
And then is Janae coming on, or I can go over attendings too?
Yeah, I mean, I can just go over this quick. So this is, obviously you're gonna work with so many different attendings while here, and it's honestly just it's like a big shock when you come in. Like they're just so highly distinguished in your fields. You're working with people that have written the textbooks that you're reading, that have given lectures and grand rounds at places that you've seen. So you're working with just incredibly brilliant people, but they're so down to earth. This is our resident lounge. Like all these pictures are in the resident lounge, so they come into the resident lounge, they hang out with us, they laugh with us. We talk. They treat us as equals, and they talk to us. Eye to eye level. It's a very, very approachable and good relationship that we have with them. And last bullet is that they look good in hats. So I'm sure there's a picture of Dr. Kirsch and Dr. Neves in hats. So, but yeah, just fantastic attendings that make the program so enjoyable to work and learn at. And finally, just a quick summary. I could leave this here because the last slide is just like a thank you. This is just where some of our residents in the last 2 years have gone. So lots of good training here, diverse exposure, and people are inspired to further their learning, but also go right into the field and feel comfortable to go right into the field after their training here too. So, whatever your plan is in the future and whatever opportunities you think you want to have, I think you're going to find it here at Kessler, because you can see just the diversity of paths that people take after their training is really all the proof there is to show that the training here is great, it's comprehensive, and it's going to make you a good physiatrist by the end. So I think the last one is just a thank you slide. So I'll just leave this here. Thanks for having us on to talk, and we'll just keep it open if anyone's got any questions.
We're at time. We truly appreciate it. A lot of good stuff.